Hi, everyone. I wanted to say thank you to the Weisses for putting this together. They are wonderful mentors and people. I picked 3 cases to present today. So the first is a long-standing patient who presented in May of 2020 with pustules and some textural irregularity at her right nasolabial fold 3.5 weeks after a home chemical peel during COVID. She has a long history of doctor shopping and treatments at multiple offices. She was prescribed 2 courses of doxycycline with minimal improvement at her 1-month follow-up, and upon further questioning, she disclosed that she had PDO threads placed at an outside office 3 to 4 months prior. Upon closer examination, she had an approximately 2 to 3 centimeter cavity from which I removed 55 intact PDO threads, along with copious purulent debris. We did copious wound irrigation, and we started a series of PicoSure Focus, or fractional picosecond 755 nanometer alexandrite, every 2 to 4 weeks for the remaining thread remnants and the resulting depressed scar. Settings were 6 millimeter spot size, 0.71 joules per centimeter squared, 10 hertz, and we did 6 to 8 passes, as well as periodic removal of extruding threads at the wound and what the patient thought were cold sores unresponsive to antivirals, but were actually just more threads. So this is after 3 PicoSure treatments, after 6, and then after the 7th and final one with some improvement. The most recent update we have is from last January, when she went elsewhere to get filler at the site and then returned to our office to have it removed. The second patient is new to our practice. She underwent gluteal fat grafting abroad in March of 2023, and shortly thereafter developed wounds and subsequent hypertrophic scarring on her buttocks and lower back. We thought they were most consistent with burns from the laser liposuction, and she had been getting intralesional Kenalog injections at the time of her consultation in September. Her main concern was the texture, as the scars were causing discomfort while sitting. We started with deep fractional CO2, or the UltraPulse Scar FX, with topical Kenalog 40. The settings were a 10 millimeter spot, 60 to 70 millijoules, density of 1 to 5%, 250 hertz, and 1 pass. She had improvement in pliability, thickness, and most importantly, pain. This is after 5 treatments. She was satisfied with the improvement in her lower back scar, so she decided to camouflage it with a tattoo revision. For the hyperpigmentation, we started PicoSure Focus, an 8 millimeter spot, 0.45 to 0.55 joules per centimeter squared, 5 hertz and 4 to 6 passes, and the treatment is ongoing. The third one is one of the most challenging ones, and it's been a little bit of a kitchen sink approach. But she, in April of 2018, had non-contact microsecond pulse 1064 nanometer ND-YAG laser at an outside office, and almost immediately after treatment developed vesicles over her glabella. Treatment was a Medrol dose pack with wound care and topical retinoid, followed by 3 sessions of microneedling with platelet-rich plasma prior to her consultation in June of 2019. For her hypo to depigmented atrophic scars, we started with subcision, followed by 2 sessions of microneedling with radiofrequency. Settings were 1 to 1.5 millimeters with 10 to 50 millijoules per pin. And here are photos after the subcision and after the Genius. She had some slight improvement. Then she had 2 rounds of filler, first with Bellatero and then Restylane L mixed with saline, and started a series of excimer laser. Unfortunately, COVID then happened, so there's a break in her treatment. She came back in July of 2020 to restart the excimer. However, the response to the filler was very temporary, and she really wanted to focus on the texture. We did 3 sessions of microneedling with intralesional Sculptra, 2 sessions of fractional 1540 nanometer erbium laser, the Icon XD, at 50 to 70 millijoules, 15 milliseconds, and 4 to 6 passes. Then with 2 sessions of the PicoSure Focus. Again, some slow improvement. After that, we started a series of Fraxel 1550 and 1927 with Lattice BID, try to repigment the area. For 1550, our settings were 35 to 50 millijoules, treatment level of 5 to 6. And 1927, it was 10 to 15 millijoules, treatment level 5 to 6, followed by 4 rounds of Sculptra. And here is after 3 rounds of the Fraxel and 2 rounds of the Sculptra. Here are her most recent photos. There's been some improvement in the atrophy and the pigmentation. Here's over almost 4 years. Our next steps will be the Interjet, which is a high-velocity, needleless pneumatic jet injector. Thank you.